I'm Father Calin, the manager for Spiritual Care Department at St. John's Hospital in Oxnard and Camarillo. I welcome you at this time to take a look at the role of spiritual care and chaplaincy within the critical setting of a hospital. This might be something new to you. You might have heard about chaplains in maybe university settings, maybe military, law enforcement, or even the aspect of correctional facilities. But in the hospital, the role of a chaplain goes much, much deeper than that. We're looking at what we will call a spiritual care bundle. This has to do with the aspects of the assessing of the spiritual needs of a patient. This goes into the realities of how to intervene during crisis interventions times as codes. This has to do with the aspects of end of life and palliative care. Another angle will be to look at the reality of health care directives and the planning for such aspects of expressing one's treatment preferences. We're looking also at long-term chronic illnesses and what are our coping mechanisms. And then we're also going to connect with the realities of the support that the chaplain is to offer in the institution as a guardian of the good morale and well-being of all those who are dedicating their life to help those who are sick and suffering. So today we're going to speak a little bit in more details about the realities of what a chaplain observes and does as they interact with a patient. Of course, we might not know this patient. They might be the first time we interact with them. It might be the first time they interact with one of us as a clergy of a different faith, a different religion, and somebody that comes now to welcome them into the spiritual culture and to offer to be their support and to journey with them through some difficult moments that imply a lot of vulnerabilities and the need to ask the biggest questions of one's existence. So for that reason, the chaplain will always approach with the spiritual dimension of realizing that every patient room is a holy ground. They are people that are having an inherent dignity. They are creating the image and the likeness of God. They are brothers and sisters who now are suffering, who now are struggling with diagnosis or tests that not only they don't necessarily understand and they're not comfortable with, but are also with the potential of really making them lose life the way they know it and threatening their very existence. So, a chaplain needs to be a welcoming presence. We are, after all, advocates for the spiritual, cultural needs of our patients. A chaplain will be paying attention to who the person is, try to connect with them to create a bond of trust and a sacred bond of care. The chaplain will be paying attention to who the patient and their families are as cultural background, as values and beliefs, and will address those with his own powers and strengths, and if that is beyond what the chaplain is comfortable with, will always look to connect the person with their own faith and beliefs and with the resources that are available in the community. Here at St. John's, we stand for a long tradition of not only educating and preparing chaplains, but really being comfortable, creating the newest standards of care in our community in all that implies spiritual care needs. So we'll see you soon to address the further realities of what a chaplain does. Have a good day.